Welcome to this explainer. Today, we're going to dive straight into the roadmap of addiction treatment, and we're breaking the whole process down step by step. Look, navigating addiction is overwhelming enough without walking into a complete clinical unknown, right? So, by the end of our time together, you're going to have a crystal clear understanding of exactly how the recovery timeline unfolds, literally from day one of detox all the way through to long-term aftercare.
How long is this actually going to take? It's the absolute most urgent, common question families ask before someone enters treatment, and honestly, it makes perfect sense. When you're facing a substance use disorder, getting a real answer to this question is key to bringing down that anxiety. It gives everyone a realistic picture of what to expect and really helps you prepare for each distinct stage of healing. So, to answer that, here is our roadmap for today. First, the recovery timeline. Second, Phase 1, medical detox. Third, Phase 2, residential treatment. Fourth, Phase 3, long-term aftercare. And finally, number 5, the zero-gap advantage. Let's jump into Section 1, the recovery timeline, mapping the journey to healing. Think of this timeline as the anchor for our entire journey. It walks us from the immediate physical dangers in those vital first few days of medical detox, transitions right into a concentrated period of residential treatment, and then extends all the way to long-term integration over the first year and beyond through aftercare and step-down care. It's not random, it's a very progressive, highly structured path.
And here is the magic number you really need to remember: 90. The National Institute on Drug Abuse, or NIDA, explicitly recommends a minimum of 90 days of combined treatment for most substance use disorders. It's not a quick fix. True recovery really requires a sustained, clinically supported commitment.
Moving right along to Section 2, Phase 1, medical detox, the crucial first 10 days. Now, what is wild and honestly incredibly important about this number is that during alcohol detox, the peak risk for severe withdrawal symptoms, we're talking seizures and delirium tremens or DTs, hits between 24 and 72 hours after the last drink. This is exactly why doing this with professional medical supervision is absolutely non-negotiable. So, to keep patients completely safe during that urgent 24 to 72-hour window, medical teams use something called the CIWA-Ar scale. Basically, instead of just guessing, doctors use this tool to measure real physical symptoms, like tremors or a spiked heart rate, so they can precisely calibrate medications in real time and ensures the body is stabilized as the alcohol leaves the system. And it's a very similar story for opioid detox, where medical teams use the COWS scale. The Clinical Opiate Withdrawal Scale provides that same incredible medical precision. It guides doctors in giving specific medications, like buprenorphine or clonidine, to make sure the severe physical dangers and, frankly, the profound discomforts of opioid withdrawal are managed safely and effectively. Zero guesswork involved. But listen, this next point is absolutely vital. Completing detox alone is clinically insufficient. Stopping right after detox is a massive mistake, because detox solely addresses the physical body, right? It completely ignores the psychological dimensions of addiction and the complex mental rewiring you actually need for true lasting recovery.
That brings us right into Section 3, Phase 2, residential treatment, rewiring the mind.
As we transition into days 10 to 40, we're shifting out of physical stabilization and diving into the deep, transformative psychological work. Now, while a 30-day stay is kind of considered the standard for residential treatment, a 45 to 90-day stay is actually far more clinically appropriate for a lot of folks. That longer duration is especially recommended if you're dealing with complex trauma, a dual diagnosis, or if someone has a history of repeating treatment.
And patients aren't just sitting around during this residential phase. They're doing the work. They engage in highly specific evidence-based talk therapies, things like cognitive behavioral therapy and trauma-informed care. Through both individual and group sessions, these tools help uncover the actual roots of the addiction, build a highly personalized relapse prevention plan, and set up a structured aftercare schedule that they'll take with them.
And this really highlights the need for comprehensive care. At facilities like iRely Recovery, you'll have a UCLA-affiliated addiction psychiatrist and a licensed clinical team treating co-occurring conditions like anxiety, depression, PTSD, and bipolar disorder right alongside the addiction through every single phase of treatment. You can't just treat the substance use, you have to treat the whole person.
All right, Section 4, Phase 3, long-term aftercare, the step-down process.
Think of this step-by-step transition as a highly structured schedule that slowly builds a person's independence while keeping a clinical safety net firmly in place. Clients step down from residential care into a partial hospitalization program or an intensive outpatient program. And then eventually, they transition into standard outpatient therapy and peer support groups. It's a gradual release, not a sudden drop-off into the real world.
Why so much structure? Because the data is crystal clear on this. The first 30 to 90 days after residential discharge represent the absolute highest risk window for relapse, bar none. Having the ongoing support of a PHP or IOP during that specific window acts as a critical defense mechanism.
Once you get past those critical first 90 days of aftercare, the focus beautifully shifts from purely clinical treatment to building what the industry calls recovery capital. These are the life assets you actually need to sustain long-term sobriety. Stuff like securing steady employment, rebuilding fractured family relationships, and fostering really strong, healthy community connections.
And speaking of relationships, family involvement is woven throughout this entire recovery timeline. Through family therapy, loved ones get clinical education on exactly what to expect from treatment. They learn that incredibly fine line between providing support and accidentally enabling, and they're trained to spot the very early warning signs of a relapse. Finally, Section 5, the Zero Gap Advantage, why continuity of care matters. How you transition between these phases can literally make or break the recovery journey. Standard care often involves these dangerous administrative transfers between separate detox clinics and residential rehabs. And those gaps, they significantly increase the risk of someone dropping out or relapsing. In contrast, a zero-gap model means clients complete both detox and residential treatment at the exact same facility with the exact same clinical team. No gaps, no risky administrative transfers.
This kind of continuous, zero-gap care is also built to be highly accessible for families who are in an immediate crisis. I mean, insurance can be verified in just 5 to 10 minutes, and same-day admission is available simply by calling their team. Removing that administrative friction is just one more way to protect the patient during those deeply vulnerable early days.
So I'm going to leave you with this one final provocative thought. We've seen the precise, evidence-based roadmap it takes to move from detox to long-term aftercare. But if treatment gaps are the single biggest threat to early recovery, can you really afford to rely on a timeline that isn't seamlessly connected? Just remember, how you transition between the phases of recovery is every bit as critical as the phases themselves. Thank you so much for joining me for this explainer, and I truly hope it gave you the clarity and structure you were looking for.